Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and I have many videos on filler techniques and other cosmetic techniques. We're going to talk about mandibular angle or lateral jaw augmentation today, which is an area that is not as frequently injected, and we do this to give some prominence to the jaw. And we're going to be talking about this point of maximum light reflex right here, and that's kind of the area that protrudes, and people that have a jaw that is lacking in anatomy in that area like to build that up to have a more angled or chiseled jaw. So that's what we're going to do in a second. We're going to augment the mandibular angle prominence on this patient, and we do this for patients who want a more chiseled outline here. We also do mandibular angle implants, which also helps that, but we're going to be able to put some filler here. In this case, we're going to use Perlane because it has a nice G prime, and we've put a little local anesthesia in here. The G prime kind of reflects on the thickness of the filler, and when we do this area, we like to layer this, where we'll put a base layer in for our deep bulk and volume, and then we'll come more superficial to add definition. And there's a lot of good-looking males: Brad Pitt, Leonardo DiCaprio, Johnny Depp, who all have prominent areas. So this is sort of the deep injection. Now, if you notice, it looks lumpy, but once we rub this out with a little Vaseline, it will start to homogenize, and now the lumps are gone, and we'll just continue. And when the average person grits their teeth together, they have a prominence that sticks out right here, and this is what we're trying to stand in front of the patient. And again, I want the prominence to be right about here, so we'll mark this, and then we want our last little bit now to become superficial and kind of have a volcano type of an effect, or a mountain peak, where it's a little bit conical and protrudes a little bit more here, so you can see we're injecting more superficially, as we want this to literally stick out further. And there's that one point on everybody's jaw that you want to duplicate as the most prominent area. So this is how we do our mandibular angle, and again, we want our augmentation to be right in this area. So for LoveThatFace.com, this is Dr. Joe Niamtu doing a little lateral jaw augmentation with Perlane.